Okay, so we're going to switch topic a little bit and talk about pain. Okay, we're just going to do a little introduction on pain, just so you have an idea of where we're heading in the future lecture. So, what is pain? Pain is an unpleasant feeling or sensation of discomfort, right? That is caused by a stimuli, like stimulation of like a pain receptor, right? It is a defense mechanism. It is telling your body that something is wrong. There is a problem. You need to, address this or pay attention to it. Now, you can have different causes, for pain. However, pain is subjective. What do I mean by subjective? It is what the person say it is, or in this case, it is what the patient say it is. You cannot see someone's pain. You can only, describe a pain to someone and then they will have to go from that. You can rate your pain also on a pain scale, right? You have a scale that's 0 to 10, 0 being no pain, 10 being the most pain that you've ever felt. And so in between that, you have mild, moderate, and severe pain. And so you can ask your patient to describe their pain. Where is the pain? How does it make you feel? There are different words that people can use to describe pain: sharp, dull, throbbing, aching, burning. And so with each of those different description, it can tell you, number one, where the pain is. Number two, what type of pain it is. Is it a muscle pain? Is it a nerve pain, right? Is it a visceral pain? And so, again, your patient will be able to tell you, that they're having pain, number one, and what type of pain it is. It is totally subjective. So you need to listen to your patient and believe them. Now, pain involves complex mechanism, right? And it's not just, oh, I'm having pain and here's medication. There are things that are happening. Pain stimuli can have a variety of origin. Where is it coming from? What is causing the pain? It can be inflammation, right, in the joint, or inflammation from infection. It could be ischemia, which means death of a tissue, or necrosis, right? Death of a tissue. It can be that you have overexerted that area, stretching the tissue or tendon or ligament, or that joint capsule. It can mean or chemical or burn exposure that is causing the pain, or it can be secondary from muscle spasm. Okay. Now, you have two ways that the pain can evolve. You can have acute pain, which means that it is sudden, it is severe, it came out of nowhere. Okay, this pain usually diminish over time as you have addressed the issue causing the pain. Okay, so it could be from injury. You stub your toe, or you slam your finger in the door. Ow. Okay, or some kind of problem that is causing you to have acute pain. Step on a nail. Okay, and so it's sharp, it is sudden, it just came on, meet in a car accident. So yeah, that can be acute pain. Chronic pain, however, is a pain that happened over a period of time. Maybe say you've been having this pain for like 3 to 6 months, and this pain is gradual. It comes on gradually. It could be like you have say arthritis, osteoporosis, cancer, different things that can cause you pain, lupus, right? These are things that can cause chronic pain. Migraines, if you're having migraines and it's lasting more than 3 months, 6 months. Some people have had migraines their whole life. They're like, you know what? I've always have pain. I'm just living with it. So that will be classified as chronic pain. Now, backtracking on acute pain, remember I tell you that acute pain is sudden, sharp, most of the time severe. Now, within acute pain, you can have a somatic pain, which can arise from your skin or your joint or your muscles, right? Somatic pain. Usually this kind of pain is sharp. Sometimes it can be dull, but usually sharp. So somatic pain, muscle, skin, joints. You can also have visceral pain. And visceral pain, when you think about visceral, like you've heard the word visceral organs, you're thinking about the different organs in the body cavity, right? Usually this pain is achy, throbby, because it's causing, poor circulation in that body organ. So you'll hear, aching pain, groaning pain, throbbing pain, cramping pain, right? If you're female, for example, and you have period cramp or menstrual cramp, that's a kind of pain that is more of a visceral pain, right? It's cramping, it's aching. So again, you can feel pain any part of your body, that have nerve endings, and you're able to identify with. Now, if someone has a chronic pain, sometimes as nurses we see that these patients can be labeled as pain seeking, right? Oh, this patient is difficult because they're always complaining about pain. This patient is difficult because they're always seeking for medication. We should not, as medical professionals, we should never think of a patient like that. We should never label a patient as pain medication seeking, right? Or attention seeking. Again, because pain is subjective. You don't know what someone is feeling. You have to take their word for it. Even in chronic pain, you have different tolerance level. Some people can tolerate an 8 out of 10 pain because they've had pain their whole life. They've gotten used to it. Their threshold has grown, and so they can tolerate that pain. Others may only be able to tolerate a 2 out of 10, right? Soon as they start to feel the pain coming on, they need something for it. It's okay. Different people, have different ways of dealing with their pain, and us as medical professionals, we are here to serve, and so we're not here to judge, right? So we are supposed to provide comfort in a dignified way and make sure that we maintain the patient's autonomy, allow them to feel like they have a say in their care. Now, if you're having pain, things can happen, right? It's going to disturb a lot of things. Your sleep pattern is going to be disturbed. If you're in severe pain, you're not going to sleep well. Your nutrition is going to be disturbed. If you're having pain, you're not going to eat well, right? You're not going to have time to be thinking about a balanced diet because you're in distress, right? You're going to have difficulty even with communication. Who is going to be able to sit and have a nice communication with you when they're in pain? Okay? You're going to become unpleasant. Some people even become depressed because they've had pain their whole life. It's a chronic pain that they had to deal with. It stopped them from going out with their friends, from doing their normal activity they used to do. They start to feel grumpy and low and blue, and they become depressed. Okay? So we as nurses and medical professionals, we cannot allow our patient to stay in pain. Now, you have another type of pain. Remember I told you that when your patient explain your pain to you, you can know where it's coming from. If it's aching or throbbing or they tell you, oh, it's like a pain, like I'm being pricked with pin and needles, right? So you have another pain that's called neuropathic pain, and that is nerve pain, okay? And when you're thinking of nerve pain, you're thinking of shooting pain, burning pain, okay? All right, so it can go away on its own, or sometimes you're going to need help. You may have to get medication or go to your chiropractor and get that pain taken care of. Now, when you're thinking of nerve damage, there are other pain that can even arise from that. There's a pain that's called phantom pain or phantom limb pain. It means that, for example, a patient lost a leg, right? They had diabetes, they have a below the knee amputation, but this patient is telling you, say, for example, a right below the knee amputation, and the patient say, I'm having pain in my right big toe. And you're looking at the patient and you're like, sir, you don't have a right big toe, right? But the patient is telling you that they're feeling the pain there. It's a phantom pain. It's called phantom pain, right? And so this is a neuropathic pain. The nerve endings, is still feeling like there's pain there, right? It's a rare condition, but your brain still gets that pain message that is telling you that that part of the body, even though it's amputated, is feeling pain. Okay? So The point of the matter is, if you're in a position, you're working in the hospital, you're working, in the medical field, and a patient tells you that they're having pain, the patient pain is what the patient say it is. Don't judge them. Don't say to them, oh, you're not feeling pain, you just want medication. As medical professions, we're here to serve. We're here to give the best care. And if the patient is telling you that they have pain, first go ahead and do your nursing judgment. Assess, the pain, the type of pain, the location of the pain, the description of the patient's pain, right? And then you're going to, after you assess, you're going to, look at the patient and see, what is it diagnosed? What is going on and how am I going to treat it? Now, after you've diagnosed that this is what's going on, you're going to go to the MAR, look to see what kind of pain medication the patient has. If there's no medication, you may want to go and, to the doctor and say, hey, I need this medication for my patient. This is the symptoms they're having, and this is, what I think is going on. Once you've gotten that medication, go ahead and implement that order. Give the medication to the patient. Go back to the patient and evaluate. See if that medication is working. If it doesn't work, you start all over again. Make sure that we give the best care to our patient. Treat them like they're our own, okay? Don't be in a position to treat someone lower than they're supposed to be treated because of our own ideas and biases, okay? So that is what I want to start out with, pain, and we'll go further into different pain medication, what are they treating, if it's a narcotic, how do we give those medication, how do we document those medication, how do we make sure that we don't commit med error. Remember what we talked about last week about preventing medication errors, right? To do your checks with you, right? Remember your rights, your right patient, your right route, right medication, right documentation, right time. So we're always going to look at that to make sure that we give the best care. Okay? Any questions?